presenting on the topic how to read scientific paper and interpret statistics.
So I just want to ask first, if you had to choose between hearing how to get a paper published versus what statistical errors are most common, what would you choose? Did you want the first about how to get your paper published, or would you rather have the second one about statistical errors that are most common? First one. Okay, we got some of both. First, second. All right, so I'm doing the Socratic method as he talked about here. So what I'll do is I'll go through a little bit of both of them, and I'll just go through some highlights, I think, of each of these issues. This is just a picture near my home in Portland in the Northwest, and these are the Olympic Mountains. And this is a beach near my house called Cannon Beach, and you have these, that's called Haystack Rock, that monolith coming out in the distance. So I would love if you come visit me sometime. So what I want to do is give a simple framework for publishing papers and avoid common mistakes with statistics. Now, this book is a book that I recommend. I have no financial interest in it. It's called Successful Scientific Writing. I didn't discover this book until about 5 years after I finished my residency, and I already had struggled through trying to write papers. And this book had really kind of revolutionized how to do this, and it makes it so much easier for me to write my papers and get them published. So why am I giving this talk? I'm on the American Journal of Ophthalmology's editorial board. I'm an executive editor of epidemiology, and I'm also on the editorial board for Journal of Glaucoma, and I do reviews for a number of different journals. And I've reviewed over 1,000 articles. And I'll tell you, with AJO, I right now have 5 to review. I got 5 today. And what I'll do in these papers, I'll look at these papers very fast, and I'll decide whether it even gets out of my list to one of the other reviewers. And the number one cause of rejection, it's unclear how researchers or clinicians would use this information. So you write a paper about pediatric glaucoma and the rates of blindness, and you don't say how I'm going to use it. I don't really know that much about pediatric glaucoma, but you don't tell me about why this is important. So that's number one. I'm just going to reject it. If you can't even tell me why it's important, I don't want to have to spend any more time on it. Number two, it's unclear how the study adds to the current literature. So sometimes when you're a resident and you're working under somebody, you think it'd be a really good idea to do a paper about something. And you spend all this work doing this paper, and then you realize that there's already been 10 papers written about this. So you've spent all this time working on this project, and you realize you're the 11th of 10 other papers. So you've got to say how it adds. Is there something different? Has there never been a study like this done in India? Is the proportions really different? What is really different about this paper? And number three cause is it does not follow a hypothesis testing framework. So it might be just something you're interested in, but you don't have an hypothesis, such as, does air pollution lead to more dry eyes? You just talk about how much dry eyes are in your community, but you don't have a hypothesis testing framework. So that's number three. And so I'm going to give a couple things from this book, which I think is very useful to write. It's really fast to write your papers. You have a 3-paragraph introduction. First one is why it's important and why should the reviewer care. So in the first paragraph, you can't tell me why this is interesting. I'm going to reject the paper. Second paragraph, what's the previous research? And really succinct. Just make sure you've done some sort of literature review on this. And the third paragraph in that first sentence is what I've already talked about, why this study adds to the literature. And your last sentence is how researchers or clinicians could use this results. Without those two things, I just go through the introduction and it's rejected if you don't put those in there. The methods, first paragraph, it's very, very important to talk about your study subjects and your IRB approval. If you don't put that in the first paragraph and I've got to look for it, I'm going to reject it. That's the first thing that I got to look. If it's not IRB approved or even sent to the IRB and they said it doesn't need to go through any type of further review, you have to have that done. The middle paragraphs of the methods should tell a story, and the story should be so detailed that somebody else, when reading it, could replicate your experiment. If they can't replicate your experiment, then it's going to get rejected. And the last paragraph is statistical analysis. The results are pretty straightforward. The first paragraph is going to talk about your study subjects and the IRB approval, and the middle paragraph is the most important findings first, or the findings in the same order as of the methods. And then the discussion, it's pretty straightforward again. I always do the same formula. Explain again, why did you do this study? We did a study on congenital glaucoma because we have the highest rates of congenital glaucoma, and no one understands why. Give your major findings. Next, congenital glaucoma was associated with family history or with genetic defects or with pollution or whatever it is. And the last sentence is how clinicians and researchers could use these results. So, working on a public health measure to treat air pollution would improve vision and prevent congenital vision loss. So you kind of tell this story, and all of a sudden, I'm like, wow, this is a good paper. It's going to get accepted. I'm going to send it out to the other reviewers. The middle paragraphs explain the most important findings in context with the literature, and then stick to your study findings. And then the last paragraph, whatever limitations you might have. My other advice is there's something called passive voice when you're writing, and there's something called active voice. Active voice means there's a subject, a verb, and an object. It's how we talk to each other. Like, hey, Sam threw a ball and hit his sister. That's active voice. Saying his sister got hit by a ball. That's passive voice. You don't know who threw the ball at. So you want to write an active voice that's much shorter, much more clear, and much more descriptive. So I'm not going to go too much over statistical errors. I'm just going to show you this one example of where I see a big error and I just reject the paper. This intention to treat analysis. And what you want to do with this one is you want to randomize them to a group of what kind of treatment, and you want to present the results of all those people that went through this treatment. So, and I'm a glaucoma specialist, so if I'm doing a new glaucoma surgery and this glaucoma surgery is new, I want to present the results in everybody who did the glaucoma surgery. So here's an example of this intention to treat analysis. We have treatment 1, treatment 2, and you'll see here you have some people that didn't finish the treatment. You're still going to report on them with an intention to treat analysis. There's a different kind of analysis called per protocol. It's a very biased analysis. And what you do is only report those that were compliant with your treatment. So if there's a huge number of people that weren't compliant with your treatment, maybe your treatment isn't a good treatment to begin with. So you always want to give your intention to treat analysis. So here's a good example of where they didn't. This is a well-published paper about a new glaucoma surgery. And they implanted one of the Zen stents. And what you can see here, they had the planted population, and what did they do? They discontinued patients because of a stent explant. So they didn't include those in the study. And this is the results of their study. And what you can see, they call it an intention to treat population because they want to get it published. But what they did is they excluded those that had a secondary complication. So again, this is a big error, and I'll reject these papers as soon as I see that. And I'm not going to go too much about this, but there's other common errors that you'll see. You need to control for both eyes if you use the study. You need to, if you have a statistician that's working with you, you need to make sure they understand how calculated values are created. And this is my last slide. Just when you're writing a paper, the first thing to do is to do a good literature review. They say one literature review, 1 hour of literature review will save you 1 month in the lab. So just do a literature review. Engage a biostatistician with your study. And I think doing a little bit of your own analysis can teach you some about statistics, and then the results should make clinical sense. So anyway, this is our group out in Portland, Oregon, and I thank you for allowing me to speak today.
Thank you, Dr. Steven. That was a very enlightening talk, I think, for all of us. So there's a query here. So a lot of times when we are sending papers from India or from other countries, we're not essentially all that comfortable with the syntax or the English or the grammar language. So how do you look at errors of those sort in the paper? Is it something that you would generally spare, or is that something again which mounts for rejection?
Yeah, so I think it's a good idea. I mean, even me, when I write papers, I like to have my wife write it or read it. She's not an ophthalmologist, she's just a teacher, but I like her to read my paper to make sure it makes sense. And so I think it's good to give it to somebody who's a native English speaker just to read it and do some of those edits. But let's say that you've done your best and you've sent it to me and you've done all those things I said. It's important, it's a new finding. You've done the statistical analysis correctly, you've reported everything correctly, it's gone through the IRB, but it has a lot of grammatical errors. We still send it through. And we have the other reviewers do that, and then we have a copy editor who will help fix all those grammatical errors. So, but the more work you put on the reviewer, the more likelihood it's going to get rejected. So you'll just want to try to get those fixed before you can send it in.
Right. So are there any questions from the audience? Somebody?
Just one more question to you.
Sure.
This is from a personal experience. Now, there was a particular rare case in glaucoma which I wrote a paper on. There were another 3 papers on the similar topic. Extremely rare case, I don't want to go into the details. They were reported in the Western literature, but never in India. But the paper was rejected, saying that already such data exists. So in these situations, do you think that reporting it in the Indian subpopulation, papers should not have been rejected? I mean, are there any criteria regarding to that?
Well, I think it goes back to that first thing. If you you have to think about this. You know, how would this add to the current literature? And if the answer is, oh, we just reported the first time here in India, then you're right. It might not be accepted, but maybe in an Indian journal it would get accepted. Or if there's something very unusual about your case, make sure you highlight that, and then that might pique the editor. You know, one case report is really hard to publish in a lot of places too. So it might be good for like a video journal or a teaching case, something like that. And then you can call it published.
Thank you.
Thank you.